Commissioner Corcoran, you want to lead us in the pledge?
Yes.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. This morning we have a presentation from USI Healthcare, and you here all by yourself?
Just today.
Okay.
My team is doing other things today. So, good morning.
Morning. Morning.
Bonnie, you want to approve the minutes first?
Oh, sorry, jumped ahead of myself. If I could have a motion to approve the regular session minutes of August 10th.
I'll make that motion.
Second.
Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes.
Commissioner Batchelor?
Yes. That's my first flub of the day. Go ahead.
Well, good morning again.
Good morning.
So, I'd like to start by just saying thank you. Thank you for allowing us to work with you and to serve you and the employees of the great state or great county of Clermont. And so we really appreciate it. We're committed to being a good steward of your benefit plan and your resources. So today, what we're going to do is talk about the results and what's happened so far in 22, and then we'll also go through the preliminary results for the renewal for next year. And keep in mind, these are preliminary; these are not the final. So we still have a lot of work to do to get some of the numbers down and bring some of the costs down. So I'll go ahead and get started. This is a report of just some of the things that happened in 2022. And so, as you probably remember, we were able to negotiate a 0% increase with United Healthcare for the administrative cost. Also in 2022, some of the plan components that we had, which were, we added hearing aids and genetic testing for mental health. We were able to facilitate a $50,000 wellness and communication budget for 22, and also a stop-loss dividend, which was just paid or will be paid soon, of $130,000 to the county. This year, we had negotiated a stop-loss renewal, which started out at 17%, down to an 8% increase. One of the big things that we did this year, which I think is a real high point, is we added a company called Paid Health to your pharmacy benefit manager, which is called Elixir. And we had projected savings of $675,000 when we did this last year. So far, the savings is $570,000, and let me clarify that. What that is that means that we have saved $570,000 that would have been billed to the county had we not put this program in. So that's in the specialty drug area completely. Also, we moved the dental to Delta Dental, improved the benefits, had a 2-year rate guarantee. We moved the vision to a company called Vision Service Plan, or VSP, with a decrease in the rate and a 4-year rate guarantee. We also renewed with Voya, with your voluntary life and LTD, for a 0% increase for 2 years. And we moved the supplemental disability, the short-term disability and long-term disability, to Trustmark, getting lower rates for the members. And also, this program is unique because it actually sits on top of your state disability. It doesn't decrease your state disability. So it would be in addition to for members who join the program. From a communication standpoint, we did a bunch of things. We put in new benefit guides. We put in a new benefits mobile app. We introduced what's called an electronic flip book, which works very similar to how some of the technology works today in Amazon. We put in brain chart videos, and we put in an employee advocate center called a Benefit Resource Center, or BRC. We also put in some advanced analytics, which we're going to see in just a few minutes, for some of the claims. The next page looks at the medical results through June. I do have some July numbers. The July numbers came out after we published this document for you, but they're very similar. Obviously just the higher numbers, but some of the percentages have stayed pretty much the same. From last year, the number of members would be employees, spouses, dependents, dropped by 2% this year. The medical claims, which is the one concern, had increased 34% on a per employee basis. That is reduced somewhat by some of the stop-loss payments that we have this year. but that's the one area where it has increased, and I'm going to go through where it's increased and some of the concerns from there. The total claim cost, which is everything added together, which includes stop-loss payments, claims, and the administration cost, increased by 14% per employee per year. And then the claim cost, which is interesting because last year we set a budget for claims, and that budget would have been the accrual that was set for this year, and we're actually running just below that at about 96%. So even though claims are higher, we're still running below the budget that we had set for this year, which was a good thing. So the cost per employee, which is an interesting number, is about $13,900, and the local government average for this area is $14,004. So you're still running just below the government average for your cost per employee. Right now, there's only one claimant that has exceeded the $250,000 stop loss, and then we have 4 others that are out there. When you look at the total of the claims, just those claimants today represent about 16% of your total claims. So, you know, it's a sizable number when you look at it. So where does this come from? So the largest increase in the medical cost resulted in really about a 30% increase in people using the hospital. That's really, when you look at all of the statistics that we have for this year, people use the hospital more this year than they have in the past 2 years. And because the severity of the conditions that they went into the hospital were more severe, they stayed about 60% longer than they have in the last couple of years. So that's really the key if you look at where the costs are driven from this year. So some of the most significant conditions, health conditions that you have in the county, high cholesterol is a big cost, high blood pressure, diabetes, cancer, liver and kidney disease, depression, and asthma. Those are the top conditions. The 3 top conditions actually represent, they're 30% higher than the norm that we see out there today for other governments.
When you say the 3 top conditions,
it would be the high
these listed
cholesterol.
are high cholesterol, high blood pressure,
Right.
and diabetes.
That's correct, right.
Okay. Thank you.
Yeah. So if I looked at the largest increase from last year in medical treatments, it happened in 2 particular areas. In respiratory problems, which is primarily asthma, and also arthritis. So that both of them were very significant increases from last year. And actually, one of the steps that we're looking at for next year will address really some of the orthopedic issues that we came up with. So the next page, I think, is a real success story. One of the things that was a real issue last year, it was identified to us, were pharmacy costs. Pharmacy costs were very high. You were paying about 31% of your total cost in pharmacy. So working with HR, we put in a program to actually address what's called specialty costs, and it has been pretty successful so far. So right now, pharmacy cost decreased 25% per employee. If you remember, we increased medical 34%, but the pharmacy cost actually decreased 24% per employee, which is a great direction. Not many employers are looking at that these days. Mm-hmm. So last year, pharmacy cost represented 31% of your total cost. This year, it's only 21%. So we've dropped 10% per employee, which is a big feat to attend to. So looking at our total cost, if we were to project it out to the end of the year, keeping it the same trend, we will save just about $900,000 in pharmacy costs compared to the prior year. So where does some of this come from? A couple of statistics. If you look at the 4th, 5th bullet, you can see that the difference between what was billed to Clermont County and what was actually paid by the pharmacy manager dropped from the prior year from 90% to 79%, which means they're a better manager than what they had before. So they're paying less and being able to shift some of the costs from what it was before. The average script price dropped from $149 to $133, primarily because of the contract that was put in place. And the average cost for specialty drugs dropped from $9,200 down to $7,400. It's not a change in number of specialty drugs. They're still the same. In fact, it's actually a slight increase in specialty drugs. It's just that because of the contract and the new program that was put in, we're actually paying less for specialty this year than we were for last year. So a good number just to look at, you know, last year you paid about 47% of your total cost for pharmacy. This year, you're paying about 39%, and that's due to the next bullet. We put in a program that sits on top of your pharmacy manager, and that program is called Paid Health. And so the Paid Health program has been very successful so far. As I mentioned, the 570,000, we had expected only for the year 675, but really the difference between what has already been presented, or what would have been presented as specialty drug cost compared to what you paid, is about 570 just through July so far. So that being the case, we'll probably exceed the expected savings. So the next couple pages just really support the bullet points that I had up there. I'm going to go ahead and jump to page 5. And page 5 is our first look at the preliminary summary for the renewal. And keep in mind, the claim cost, which drives probably 75–80% of the total cost of everything, is really motivated or influenced by the increase in the medical costs that I mentioned earlier. So that's what's really driving some of this stuff today. So if we go through here, we can see that in the current column today, your administration cost is about $670,000. The renewal from United Healthcare is about a 1.9% increase. And again, that was a contractual number that was out there. The stop-loss premium right now is about $960,000. The renewal that has been asked for, and again, this is preliminary, and we know that this will change quite a bit, came in at $1.1 million, which is a 14% increase. Total fixed cost, you add the two together, you come up with about 9% increase. Then you look at your claim cost, and this 5.8% is really influenced by the increase in the medical cost that we have this year. So right now, the current expected cost, which is really the budget number I mentioned before, is $12.2 million. The initial number that came in was 12.9. We expect that number to come down just a little bit, even from where it is. So when you roll it all together, the current budget or current expectation cost is $13,800,000 compared to a renewal number of about $14,600,000 or 6.2%. And again, this is a preliminary number, and we're pretty confident that we can take that number down some. Any questions so far? Okay, all right. So as I mentioned, some of the things that are influencing this are the bullets down below, which is the increase in the medical costs, which are driven from some of the claims that we've had out there.
Just a question.
Yeah.
With current legislation that's being talked about right now, what's the expectation as far as drug costs and them looking at it? As you know, national news is all over the fact that, Medicaid negotiations are going to result in some of those drugs being at a lower price. Is that going to move into this industry also?
So it's a good question, and USI has a pharmacy expert that we have several, but we have one guy that works with the county specifically, and he was in a symposium in Washington, D.C., talking about pharmacy cost. And the speaker actually said that a lot of people don't realize that today every congressman and every senator has assigned to them at least 100 pharmacy lobbyists to influence the pharmacy direction these days. The point being is that there's a lot of lobbyists that are trying to keep the cost to where they're at today. And so his expectation was, he was not very positive about some things happening just because of that influence right there. So, you would think with all the discussion that's going on today in politics that there would be something, but I suspect that there's some other factors that are driving the other way. So page 6 just summarizes it all. So you can see so far we went out to 8 different stop-loss carriers. These are A+ rated stop-loss carriers. And then the preliminary results, as I mentioned, was a 6.2%. That's a 1.9 in admin, 14% in stop-loss, and 5.8% in claim cost. We do have an alternative offer out right now that's at 1.3 total. However, the terms of the proposal are not quite the same. There's some guarantees and things that are not quite the same with this. So we have some work to get that keyed up. The next page is just the detail behind the bullet points. And then we go to the benchmarking analysis, which is something we presented to the Healthcare Committee as well as HR. And as you can see that in your, I'm going to focus on the HSA plan first, which is the bottom section. The bottom section, you can see that the deductible, co-insurance, out-of-pocket max, all of these things compares your current year cost to the prior year for everybody else. So we look at county governments the prior year, 1,000 employees plus companies and or organizations, and then the Midwest area in total. So last year's numbers. And so you can see when you compare this to that you're very competitive for the HSA plan. For the copay plan, you can see that the deductible is higher than most people out there. That was intentional a few years ago, I think, to kind of, that's the most expensive plan. I think the intention was to try to migrate people into the HSA plan as an option. The out-of-pocket max, there have been some discussion with HR and also the Healthcare Committee about looking at the out-of-pocket max for that plan. That was something that was occurred several years ago, and maybe maybe there's some interest in maybe lowering that to be a little bit more competitive. So the next piece is the other insurance programs for 2023. USI has negotiated zero cost increase for the dental, the vision, the life, and the disability. So for that perspective, we're already set for next year. So I mentioned we're going to talk about what drives some of this, and so this comes from a lot of the analytics that USI gathers from United Healthcare. As you can see at the bottom, orthopedic problems are driving really most of the cost today. One of the things that HR is considering and looking at right now is focusing in on a center of excellence through Christ Hospital, and I know that Yvonne is going to and Sandy are going to take a look at that in the next few weeks as maybe incentivizing people to belong to that program. It's already in the plan, but we want to really get more people into that program. That will help bring some of this number down, and I think the quality of care will probably go up in some cases. So, same thing with the heart problems. That's the second largest increase or second largest cost that you have out there. We haven't explored it. Christ also offers a center of excellence in heart care. That might be something to consider. Some discounts, some guarantees, some things like that that's involved in it. And then, of course, we talked about diabetes. Diabetes is a big problem, not just with the county, but with most employers today. It's a big concern. Obviously, your average age in the county is a little higher than most other employers, and so diabetes tends to be something that's a concern. You can see at the very first one, the metabolic problems. Most of the diabetes come from metabolic problems, so the two of them are pretty related when you look at it. So one of the things that we are looking at, the county has had a wellness program for a while, and it's very successful. This chart shows you something that you probably don't see. It says what % of your people are not doing what they should be doing. And so let's just look at the second bullet, and it's members without a wellness visit in the last 12 months. And you can see that it's only 11% of your members who didn't get their wellness visit. That's great. Those are good numbers. The average out in the marketplace today is probably around 65, 70%. So the fact that you guys are driving today a number that is 88%, that's a really good number that you can do this. There are some things that are gaps beyond that. So you would think that with doctors seeing people with their wellness visit, that they would also encourage them to do other type of screenings. I'll point to the women's health care items, which are the second to last and third to last line. So women's health care, you can see that the number of women that should have things done that are not averages between 60 and 70%. So that's a big number. And so, those are left undone over a period of time that could cause other problems that can occur. Same thing with the first line. Members who should be getting colon cancer screenings, you can see that that's close to 70%. So those are some of the things that we might want to focus on in the future, and we've talked about that with HR and the Healthcare Committee as well. The next page does the same thing, looks at people who have certain conditions who should be doing preventive things, but they're not doing preventive things. So the first one is diabetes, and you can see that you've got 10 people today that are at risk for significant diabetes problems, complications. You have 2 people only that didn't do what was called a lipid test, which is one of the most important things that you would probably do in that, which is not bad in terms of this. You would like to see that number at 0, but still there's some opportunity there. And then you've got people with heart. I think I've flipped the 2, so really the top one is heart and the bottom one is diabetes. So I will correct that and get that to you. But if you look at the most important thing at the bottom section, which is really diabetes, is for members to check what's called their A1C level each year. In fact, the recommendation by the U.S. Task Force on Preventive Medicine says that people should do it at least 2 times a year. And so right now in Clermont County, there's a gap of about 67%. So those are some areas I think that working with HR and your healthcare committee that we can improve by putting in some programs and maybe expanding the wellness program. So the last slide, which is some considerations, and we talked about this, maybe exploring opportunities for some age and gender screenings to expand the whole process for wellness, looking at some more support for diabetics and those who are diagnosed with heart disease, and then expanding the mental health programs and substance abuse. And so we did have a meeting recently with the Employee Assistance Program, just trying to identify some of the weaknesses and trying to improve some of those areas that are going on. So, any questions?
And I'm just asking because I really don't know. Any consideration when it comes to health insurance by employees who actually worked prior to coming here in another profession where obviously they have access to Part A and B, on.
Yeah, that's a good point. It's one of the things that we have talked with HR about having what's referred to as a Medicare education. And I think you had a person here from, what was the group you had here?
We had Medicare and Social Security
Right.
and OPERS.
Right. So, and that was there. And we would be happy because we have a pretty healthy Medicare education program to encourage people to look at that as an option. And sometimes it is a great option because, a Medicare Advantage plan could be no cost to the employee and has no deductible and everything. So it's really worthwhile to explore that. It's a good question. So.
Is that anything that could result in savings to the county?
Oh, absolutely could. Right.
That option?
Oh, yeah, sure. Right.
And is that something that the committee could take a look at as far as, maybe what does that even look like? How many people are actually employed by the county that could exercise that option?
So it's interesting because it has to be the employee's decision on their own. You can't incent them. It would be, it'd be a Medicare violation to do that. But oftentimes people look and say, instead of paying the cost out of my paycheck, if the option is no cost, and instead of having a deductible, if the option is no deductible, we can pretty much show them that there could be some advantage in the program. Now, one of the things that takes away from that is the person would have to buy Medicare Part B, right, which that could offset some of the cost of this. And so, but when people look at it and look at it hard, sometimes it's a good choice for them. So,
thank you.
Okay.
Thank you.
Well, thank you. I appreciate your help.
Okay, moving on to item D, public participation. Don't see anyone. Moving on to item E, consent agenda. Board, we've had this in time to review. Are there any corrections or deletions to the consent agenda?
None?
I would accept a motion to approve.
So moved.
I'll second.
Roll call, Holly?
Commissioner Painter?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Batchelor?
Yes. Item F, non-consent agenda. Item number 8, it is the recommendation that the Board of County Commissioners adopt resolution number 118-22 resolving to approve payment to vendors in the total amount of $4,882,706.63 as set forth in the BCC approval invoice report for checks dated August 17, 2022, BCC directed prepaid invoice reports and/or the procurement card transaction report as presented by the county auditor on August 15, 2022, and further authorizing the county auditor to issue warrants for same pursuant to Section 319.16 of the Ohio Revised Code. Do I have a motion to approve?
I'll make the motion.
Second.
Holly, is there one big one that stands out?
You.
Commissioner Batchelor, there's actually several that stood
Yeah.
out this week. Our paving project has continued in Clermont County, the wastewater treatment plant in Newtonsville, the wastewater collection system in Newtonsville as well, and senior services received their share of their levy funding this week as well. So that makes up the grand.
I thank you for sending that report to us, so we weren't too shocked, but I wanted to get it on the record, and people listening might have an idea where some of this went. Roll call, please.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes. Number 9, Connie, good morning.
Good morning. Item number 9 is the recommendation of Thomas J. Eigel, County Administrator, to authorize Susan Walther, Director of Department of Job and Family Services, to execute an agreement for early intervention service coordination by and between the Clermont County Department of Job and Family Services, acting in its role as administrative agent for the Clermont County Family and Children First, and the Clermont County Board of Developmental Disabilities, located in Batavia, Ohio, for the provision of early intervention service coordination services to families with children from birth to age 2 with developmental delays, as outlined in the project narrative attached thereto and incorporated therein as Attachment A, in an amount not to exceed $547,580 for state fiscal year 2023, effective for the period of July 1, 2022 through June 30th of 23, pursuant to the terms and conditions specified therein, and in concert with the Early Intervention Service Coordination Grant Agreement by and between Clermont County, Ohio, and the Ohio Department of Developmental Delays, previously ratified by the Board of County Commissioners on May the 4th, 2022, in conjunction with Part C of the Individuals with Disabilities Education Act, and contingent upon the release of the required purchase order in concert with requisition number 4277, dated August the 8th of 2022, relative thereto.
Thank you, Connie. Board, you've heard the reading of item number 9. Do I have a motion to approve?
So moved.
I'll second.
Any discussion?
None.
Roll call, Holly.
Commissioner Painter.
Yes.
Commissioner Corcoran. Commissioner Batchelor.
Yes. Number 10,
Recommendation of Susan Walther, the Director of Department of Job and Family Services, with concurrence of Thomas J. Eigel, County Administrator, to execute the contract for services by and between the County of Clermont, Ohio, and Child Focus Incorporated, located in Cincinnati, Ohio, for the provision of independent living life skills training services for youth 14 years of age and older who are in the custody of the Department of Job and Family Services Child Support Enforcement Division, at the rate of $8,724.20 per each 8-week training series, including pre- and post-individual sessions, for a total amount not to exceed $52,345.20. It's effective upon execution by all parties for a period of 12 months, pursuant to the terms and conditions specified therein, and contingent upon the release of the required purchase order in concert with requisition number 4301-00, dated August the 4th, 2022.
thank you. Board, we've had the reading of item number 10. Do I have a motion to approve?
I'll make the motion.
Second.
Any discussion?
Excuse me, I apologize, that's why I stuttered when I read this. This should say, not the Child Support Enforcement Division, but it should be Children's Protective Services. Yes.
I thought it was just me. I kind
No.
of held off for a minute.
No, I'm
Thank
sorry.
you.
Sorry for that error.
No, that's fine. Thank you.
So with that correction,
With that correction, I'll make the motion.
And I'll second as amended.
thank you. Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes.
Thank you.
Thank you. Mary Raines, number 11.
Good morning. Number 11 is the recommendation to establish 2 bond funds for the Newtonsville project. One is for the Newtonsville Treatment Plant Bond Fund, and the other one is the Newtonsville Sewer System Bond Fund. And this is the requirement of code to keep the bonds in a separate fund. It's just a routine matter.
Okay. Board, you've heard the reading, explanation of number 11. Do I have a motion to approve?
So moved.
Second?
Any discussion? Roll call, Holly?
Commissioner Painter?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Batchelor?
Yes, thank you, Mary. Number 12, Suki?
Morning, Board. Number 12 is a recommendation of Jeremy Evans, the county engineer, and this is to adopt the Clermont County Roundabout Enhancement Policy that sets forth the criteria for approval and placement of mounting and landscaping within and around the roundabouts on county and township roads. This will be implemented and administered by the county engineer's office as attached hereto and made a part thereof, approval upon, and it will be effective upon approval. So with the new roundabouts that are coming in the county, we wanted to make sure there was a policy in place to make sure the center island and the splitter islands and some of the outside areas are landscaped to the point where it ensures the safety of the traveling public. So we're controlling a little bit of what's going on in those center islands and outside areas.
And also, it protects the landowners that are around it and how close those things. I know there was some discussion about putting one on Woodville and Deerfield, and I went over, looked at it twice and went, how are they going to put something like that?
So there are such things as, and I may not have the right term, a smaller roundabout. So if you remember the one up outside Jungle Gyms,
Yes.
there's also a different kind of a roundabout down on Commerce or Chamber Drive and Beechwood.
Yes.
Okay,
Yeah.
something similar to that, smaller, would fit up in Woodville and Deerfield.
Okay.
So it would allow traffic, the continuous flow, which is what's been the issue up there. And if a truck was going through, they call them mountable center islands, so it wouldn't even be landscaped. It would be more of a hard surface, and a truck that can't make the smaller radius could mount up over that center island and make the turn that they need to make.
Great. Thank you.
Suki, with this particular plan, this is only applicable to county roadways, correct? This is not going to,
County and township, not state, federal, or municipal.
okay,
We have
so
it-
it is
we have-
county and
And
township.
township roadways, yep.
And one of those roads I was speaking about is county, and it's like, okay, how are they going to do this?
Yeah.
All right,
It's
great.
tight up there, but we have consultants under contract right now that are going to give us ideas on how that could work.
Great. Thank
But
you.
a state road located within a township,
No,
no input. Okay.
Okay,
Okay.
so do I have a motion to approve item number 12?
So moved.
Second?
Roll call, Holly?
Commissioner Painter?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Batchelor?
Yes, thank you, Suki.
Thank you, Susan.
Lyle, good morning.
Good morning. Item 13 is a rejection to reject all bids received on June 30th, 2022 for project number 6402-60148 relative to the 9-mile collection system improvements project located in Pierce Township pursuant to and in compliance with Chapter 307 of the Ohio Revised Code relative to the terms and conditions of public bidding and to approve the request to re-advertise for bids for the project pursuant to and in compliance with the specifications, and to authorize the clerk of the board to place a legal notice in a newspaper of general circulation on Thursday, August 25th, 2022. Schedule a non-mandatory pre-bid meeting on Thursday, September 8th, 2022 at 1:00 p.m. with bids to be received until 2:00 p.m. local time on Thursday, September 15th, 2022. Here in the office of the Board of County Commissioners, 101 East Main Street, Batavia, where label will be publicly open and read aloud shortly thereafter, and the legal notice will also be posted on the county's website.
Board, you've heard the reading of item number 13. Do I have a motion to approve?
Make the motion.
Second.
Lyle, can you explain why we are rejecting?
The low bid had some discrepancies in their unit prices. For example, they have a very low unit price for controlled density fill, and there's a large quantity of controlled density fill needed on the project, so there were some concerns with an imbalanced bid. And prosecutor's office agreed, and they weren't real comfortable awarding to that contract. So we thought it would be better just to reject all bids, rebid it, and hopefully we get more responsive bids the second time.
Thank you.
So the bids actually came in within the competitive range, though,
Correct.
as far as the overall price?
Yes.
Okay, Holly, roll call.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes, thank you, Lyle.
Thank you.
Number 14, Michael.
Morning.
Morning, Commissioners.
Good morning.
Michael McNamara, Director of Community and Economic Development. Item number 14 is a recommendation of Michael McNamara to reappoint the following individuals to serve on the Board of Directors for the Clermont County Port Authority for the terms outlined below. Greg DeFisher and John Walliver. Greg DeFisher is going for his second full term, August 20th, 2022 through August 19th, 2026. And John Walliver, first full term, so he was finishing an unexpired term, August 20th, 2022 through August 19th, 2026.
Board, you've heard the reading of item number 14. Do I have a motion to approve?
So moved.
Second?
Any discussion?
These were actually listed. Holly, we have information about that. We actually had them on the website if anyone wanted to apply.
I
Nope.
don't think so.
We're constantly promoting in the same way we do all of our boards for applicants. When I get applicants in, I will reach out to them. I will say that these two are exemplary members of the board. They attend almost every meeting, so their attendance is very good, which is difficult to find. Board participation where board members are present, so that's a valuable component, as well as John Walliver brings a legal mind to the board, which without him we don't currently have, and Greg DeFisher, being a local business owner, brings that perspective to the board. So these are perspectives that we desire, that we seek out on the board. I asked both of them if they were willing to serve another term, and they were both agreeable.
And finding people that are willing to give up their time during the day to participate in these meetings too.
Right, and with the Port Authority being a very specific board, they handles very specific issues. We want people that have a full county viewpoint.
They've done an excellent job, I mean, I know I've sat in on a bunch of those Port Authority meetings, and, they've been always in attendance and always participating where it needed to be. My question was just, we've made an effort to try to get more people that want to actually serve on boards. And so we've tried whenever there's, a date coming up where someone's term expires or there's a vacancy on the board, we try to gain, resumes and applications from anyone that would like to participate.
Yes.
That was my only question.
I have discussed with the Port Authority about the possibility of asking the commissioners to appoint 2 additional members, but I want to make sure that I can get 2 parties that would be willing to serve, that would attend meetings, and participate.
Okay.
Well, and also, as some background information, we have we've changed the different way that we advertise at boards that are open and what boards people can serve on. I know Angie helped us get it so that when you come on the commissioner site, it's posted there so you can see what boards and what is open. And we're making an effort to make sure that people know that those things are open. I understand these 2 appointments, but I did question at the time whether or not it was advertised out there before we just appoint people. So I think we're all right at this point.
Okay.
Anything else?
No,
No?
that was it.
Okay.
Okay, then, roll call.
Commissioner Painter.
Yes,
Commissioner Corcoran.
Yes.
Commissioner Batchelor.
Yes.
Thank you.
Michael.
thanks.
Greg, you got the next one?
I do. Ms. Haverclose is on a well-deserved vacation.
Good
as we
for
move into
her.
a long-term recovery for Goshen. So I'm here today to talk about our local emergency planning committee. As you know, Mr. Cascaden retired last week, and you appointed Jessica Wiederhold. So this is a motion to replace John on the LEPC with Jessica. And then we have another spot available. It's in the community group category. It's Rob Wing, who is the owner of Wing Media, and they like to have a media person on the LEPC. So it's Pam's recommendation with my concurrence to replace those two individuals on the LEPC effective 7/21/22 upon approval through 8/14 of 2023 in pursuant to and in compliance with section 3750.03B of the Ohio Revised Code.
Thank you. Board, you've heard the reading of item number 15. Do I have a motion to approve?
I'll make the motion. I did review this also.
Second.
And I will just say, this is a good example. Rob Wing reached out when he saw where there was an opening, and this was one of the reasons we kind of asked Angie to revamp how you go in and see the boards, because he made a phone call here, couldn't find that, and now it's much easier to be able to go in, so.
And the LEPC is a unique board. You really don't see a lot of what they do, but they're the ones that work on some of the hazardous spills, some of the modeling, some of the things that happen when there is a disaster. This group is behind the scenes, kind of setting some of that up to how we respond. So it's an important group.
And Greg, just for clarification, I understand that Mr. Wing's appointment to this board is really expanding a position for appointments of the commissioners.
Yep.
Okay.
Anything else? Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Bachelor.
Yes. Thank you.
Thank you.
Holly, you're up.
This is a recommendation to amend Resolution Number 114-22, previously adopted by the Board of County Commissioners on August 3rd, 2022, resolving to, 1, acknowledge the publication of a notice of public hearing in the Cincinnati Enquirer on Wednesday, August 10th, 2022, designating Wednesday, August 24th, 2022 at 11 a.m. as the date, time, and of the rescheduled public hearing required to be held by the Board of County Commissioners on the proposed issuance of the County of Allen, Ohio Hospital Facilities Revenue Bond Series 2022. Bond secures Mercy Health. Number 2, increasing the overall bond issuance estimate amount from $200 million to $300 million. 3, increasing the not to exceed principal amount to be spent in Clermont County from up to $10 million to up to $15 million. And 4, to refinance all or a portion of a taxable loan, the proceeds of which refunded the outstanding principal amount of the $89,425,000 County of Allen, Ohio adjustable rate hospital facility revenue bond series 2017B. Commissioners, you may recall we were scheduled to have a public hearing today regarding these hospital bonds. They have come back, bond counsel has come back to the board and asked that the bonds be modified, and to the extent that the modifications were material, I had suggested perhaps the board need to acknowledge these changes that they are requesting, and we will go ahead then and schedule a public hearing for the 24th with these new understandings.
So this is just an acknowledgement today, correct?
Correct.
Okay.
Okay. Board, you've heard the reading of item number 16. Do I have a motion to approve?
So moved.
I'll second.
Any discussion? Roll call, Holly.
Commissioner Painter.
Yes.
Commissioner Corcoran. Commissioner Bachelor.
Yes. Number 17.
Number 17 is the recommendation to acknowledge the filing of a petition for annexation of 4.906 acres of real estate identified as parcel identification number 323015B041P from Tate Township, Clermont County, Ohio, to the village of Bethel, Clermont County, Ohio, filed in the office of the Board of County Commissioners on Wednesday, August 10th, 2022 at 11:20 a.m. by Mary Irwin for and on behalf of Emily Supsinger of Strauss Troy, located in Cincinnati, Ohio, who is the designated agent for the petitioner John Caldwell of 225 North Cross Street in West Union, pursuant to section 709.023 of the Ohio Revised Code.
Board, you've heard the reading of item number 17. Do I have a motion to approve?
Make the motion.
Second.
Any discussion? Roll call, please.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes, thank you. Angie?
Yes, item number 18 is the recommendation of Thomas J. Eigel, County Administrator, to approve the following request of reimbursement of expenses for training and travel pursuant to the policies and procedures of the Board of County Commissioners and in compliance with the annual appropriations for calendar year 2022. This is for Commissioner Bonnie J. Batchelor to attend County Commissioners Association of Ohio, CCAO, Workforce, Families, and Children Symposium in Columbus, Ohio, with a cost of $50.
Board, you've heard the reading of item number 18. Do I have a motion to approve?
Make the,
Oh, go
sorry,
ahead. Go ahead.
I'll make the motion.
Second.
Thank you.
Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
I will abstain. Item number 19.
Item number 19 is also the recommendation of Thomas J. Eigel, County Administrator, to approve the same request for Commissioner Claire B. Corcoran to attend the CCAO Workforce, Families, and Children Symposium in Columbus, Ohio, at a cost of $50.
Board, you've heard the reading of item number 19. Do I have a motion to approve?
So moved.
I will second. Roll call, Holly.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes,
Commissioner Corcoran.
Abstain.
thank you. Mary's back.
Item 20 is a request to increase the 2022 annual appropriation in the Narcotics Unit Fund for a retirement payout in the amount of $22,715.
Thank you. Board, you've heard the reading of item number 20. Do I have a motion to approve?
Make the motion.
Second.
Any discussion? Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes. Thank you, Mary. Item number G, additions to the agenda. We do,
We have, well, first we'll do the building permit fee extension. So there's a request to extend the building permit fee waiver for the Goshen tornado. So we have to add that first, and then I'll have Mr.
okay, can I have, thank you. Can I have a motion to add that to the agenda?
So moved.
I'll second.
Roll call, Holly.
Commissioner Painter.
Yes.
Commissioner Corcoran.
Yes.
Commissioner Batchelor.
Yes.
So if you recall, we did waive building permit fees through August 8th. One thing we learned through the tornado that there's a lot of property destroyed, but a lot of people took advantage of this and were able to add on to their houses. Obviously, it's tough to get an architect these days, as we very well know. So we've had a couple plans that have been submitted after the deadline that are a result of the tornado, and there'll be improvements to the house. So the Bruce Crace is asking that we extend this through the end of September, because we think there's still a couple more out there that are going to be improved as a result of the tornado. So I have a resolution, or a motion amending resolution number 097-22 to extend the waiver of county imposed permits and inspection fees submitted on before August 8th to on or before September 30th, 2022 for permits and fees directly related to damage caused by the severe storm on July 6th, 2022 within Clermont County, pursuant to the emergency declared by the Board of County Commissioners on July 7th, 2022.
Thank you. Board, you've heard the reading. Do I have a motion to approve?
I'll make the motion.
Second.
Any discussion? Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes. Thank you, Greg. Moving on to item H, executive session.
Yeah, we just want to add E1, which is to consider the employment of compensation of a public employee or more public employees to executive session.
Do we have to have a motion to do that, sir?
Yes, just add that.
Okay, can I have a motion to add that one?
So moved.
I'll second.
Roll call, Holly.
Commissioner Painter.
Yes.
Commissioner Corcoran.
Yes.
Commissioner Batchelor.
Yes. So item H will be executive session pursuant to section 12122G1 and G3 of the Ohio Revised Code to 1, consider the employment and compensation of a public employee or more public employees, and 2, to confer with the prosecuting attorney concerning disputes involving the public body that are the subject of pending or imminent court action respectfully. We will be back.
Need a motion?
My motion to go in.
I guess we better do that.
I guess I'll give you the motion.
Okay, thank you. Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes.
Commissioner Batchelor.
Yes. Now we will be back. We have returned from executive session. And in executive session, we discussed the employment and compensation of a public employee or more public employees, and conferred with the prosecuting attorney concerning disputes involving the public body that are the subject of pending or imminent court actions with no action taken or decisions made. And at this time, we'll move on to item I, and that is county staff elected official discussion. Anything?
Greg, you're the only one here.
I want
Okay.
you to discuss something with us.
Discuss.
Okay. Okay, then moving on. Item J, members' comments. Commissioner Painter, anything?
You know, might want to just talk about, did I see where Nestle Purina made a contribution to local dog effort?
I have not heard that.
Yes, they
It was not to us.
Mm-hmm.
It was it Bethel? Did I read that right or wrong? It was out on Facebook,
It was.
and they donated a whole bunch of, was it food and all
Yes.
kinds of stuff to support the community for Community Day, because they're very active in community projects. And I saw it, was it the free?
Was it the free
came-
store?
It came out on Facebook, and it was a wonderful contribution. Thank you for bringing it up.
Yeah, it's just another example where, you know, companies like that to, you know, become an anchor, you know, company in your county, you know, really put what they do out there in the community. You know, it seems like every time that, you know, Nestle Purina South Afton has been asked for a contribution for our dog kennel, you know, they have contributed to that. They contributed to a new dog park down in New Richmond.
They've been very generous since they've come to the community.
Absolutely. And, you know, has anybody ever talked about a real groundbreaking for that facility? You know, that was postponed for a long time, and, you know, it was supposed to happen, and that's really never happened. So because of the pandemic, they really haven't gotten the recognition that they should get. But I just want to make sure that we recognize them for,
I didn't see that. so
you
I'm
know,
glad you
continuing
brought it up.
to help in the community any way they can when they're asked. So, fantastic.
I thought we were talking about a groundbreaking in '23, weren't we?
They have moved that back for quite some time now, but yeah.
Anything else?
No, ma'am.
Okay, I would accept the motion to adjourn.
So moved.
Second.
Roll call, Holly.
Commissioner Painter.
Yes.
Commissioner Corcoran.
Yes.
Commissioner Batchelor.
Yes. We will see you next week. Thank you.